Thank you, Devin. And according to the CDC, up to 3 in 10 children with a sore throat actually have strep throat, and about 1 in 10 adults with a sore throat have strep throat as well.
And here to tell us more about strep and how you can keep your family safe is our very own nurse, Christina Paris. So thank you so much for coming in.
Hi, good morning. Glad to be here.
Yes, glad you're here. Glad we're all here and healthy.
Yes.
That's a big win.
No sore throats here.
No.
Absolutely. So tell us a little bit about it. What is strep throat?
So strep throat is a type of bacterial infection caused by Streptococcus A strain of bacteria. And so it can be, we use antibiotics for bacterial infections. Right. And it can cause your tonsils, so that tissue in the back of your throat, to get very swollen. Often you'll see little white patches, and it's very contagious if your child coughs, or if you cough, or you share foods or drinks, or they touch tables after touching their mouth or nose. That's how those things are spread, so by touching. So it's good to kind of clean.
And since it's a bacterial infection, that is nice that they do have the medicine that they can take for that.
Right, absolutely, yeah.
So some of the symptoms we're going to be looking at, what are those going to be today?
So, of course, you're going to have a sore throat. You will have a fever as well. You can also, like the swollen glands, like I said, the white patches on the back, pain with swallowing, and sometimes there's even like little tiny dots that will occur in your mouth. The lymph nodes, so the little areas right underneath your chin on the side of your neck, might feel really swollen and tender. And, of course, you're going to have those enlarged tonsils. So incubation period, so you might get exposed, but it'll take a good, 2 to 5 days at times before you'll even feel the symptoms come on. And so it can take that time to grow, but you're also contagious. Typically, if you have a cough, a runny nose, pink eye, things like that, you probably don't have strep throat. So you can get a sore throat with COVID, with flu, with any kind of common cold. So typically people get really concerned when they have that really severe raw sore throat that it's strep. And in most cases, it's not. You also can be a carrier of strep, so they can test you if you don't have any symptoms. Some people just carry the bacteria naturally in their nose or mouth. We have that with E. coli in our gut, so some people just have E. coli naturally in their bellies and don't get sick from it. So there's that as well.
Interesting. And then talk a little bit about how you can maybe treat strep throat and also the test for it. I've gotten the test a few times, and I am personally not a fan of it.
No, because we have to go very far back with the swab, and we touch that uvula, that little thing that hangs down, and it causes that gag reflex, which is good. That means you have a good solid gag reflex. But it is very uncomfortable. But that is how they can also do blood tests. They can check your white blood cells to see if there's infection in your body. I mean, it's not specific to strep. It would just say, yep, your body is working to fight off something. And so, yep, we give antibiotics. You can also try things like using a humidifier in your home to keep things moist, especially now when we have the heat on and it's very dry. You can try throat lozenges or throat sprays. Sometimes those will help. Just taking sometimes Tylenol or Advil, things like that, can help with the pain and discomfort. With kids, you can give them popsicles. They can drink, really cold fluids, Jello, things like that feel kind of comforting on the throat, or warm liquid if you're an adult. You can have hot tea or even warm salt water.
So it seems like a lot of the treatment is more just so managing the pain, and then the antibiotics are going to be the actual.
Absolutely, that'll be supportive care. And again, the culture would have to show that you have strep for that to be effective.
Interesting. And I know you talked about how it could, inflame inflame the tonsils. What does this sort of look like for people who had their tonsils removed?
So you still will have there's still some tonsil tissue back there. And so your throat, yes, probably won't swell up as much, but it will be back there on that
You'll
tissue.
still have all that irritation.
Yeah, and there's always, I mean, it's hard to get all of that tissue removed when they're taking out.
And I heard this, I may be wrong, but some people get their tonsils removed because, like, from getting strep so frequently.
Right, yeah, absolutely. As a kid, that was kind of, when I was growing up, what we did. If you had a lot of strep throat and you had a lot of sore throat issues, they would remove the tonsils.
I'm part of that camp, but as an adult, I think I got mine out at like 22 or 23.
Oh, really?
Horrible experience.
Yeah.
Horrible.
At least when you're a kid, they give you like the ice cream. Like it's like you're treated like royalty, but I don't know if anyone did that to you.
No, my folks, they didn't look after me. My dad and stepmom, they were there, but then it was just a very unpleasant time.
It is.
It's not
I
fun.
was 12, so I was older too when I had mine out.
So hopefully, folks do that when you're younger, so you don't have to do it when you're old.
Mine.
Do you? Okay.
I do.
Oh boy.
Yeah.
So we'll see.
Well, thanks for coming on this morning and talking about strep
Absolutely.
throat.
Thank
Really
you so much.
appreciate it.
Absolutely.
And coming up, we have What's Trending.